Coach Tess from HealthEversity, and today we are going to be focusing on musculoskeletal keywords for the CPC Certification Board exam. So let's jump right into it. Now, when you're looking for keywords on a scenario, it's good that you have knowledge of what procedures look like, what diagnosis look like, and other terms such as medical terminology and AMP, which is your body parts, so, and certain other terminologies that they use in the scenario which will help you. Okay, so right now we're going to jump into it. This book that I use is a book that I studied when I was doing my certification years ago, and it helped me a whole lot. If you use your study guide, like I always say, look at the back of the book for the glossary. It will surely help you, and you make a notes in your book so you don't forget what you learned, just like a note from an instructor you've gotten before. If you're reading a scenario, you might see a word. It will truly help you. So the glossary of the study guide is very, very helpful. And what I suggest you do is, like, when you go through it, just look on the scenario, not the scenario, but look on the wording, and you can look and see if it says what a doctor is doing versus a body part or a diagnosis. So you can put P for procedure, A and P for a body part, and a D for diagnosis. So let's get right into it. So now, look at this. It says in the glossary of this, it's an AAPC book, so that's what we're using, right? So it says allograph. Allograph, right here, transplanting. So you know that is something that the doctor did or a surgeon did, so that is a procedure. All right, so let's go down. Some of them, you see anterior circuit ligament, a lot of students tear that. So you'll see that that is a body part. All right, arthritis, itis. Look at the suffix itis, which is an inflammation. Okay, so that's a diagnosis. What I did was highlighted some of the procedure in green, so it basically jumped out to me. If I'm going to do a question like this again, it jumps out to me. Okay, so now we had allogram. Allogram is an x-ray, so gram is a suffix. Arthroscopy, scopy is a suffix. So I normally use scopy to tell me that is the doctor's eyes or the technician. What are they looking for? Either for a therapeutic procedure or a diagnostic procedure. So this is an arthroscopy, and this is what they're looking for. Diagnostics or therapeutic. And it's a scope right there. All right. So then you have the arthropathy, which is a disease. So now you look like some people might have rhinopathy, all different type of pathy, which is a disease. So it's that you look at, all right? Let's look on this one now. So if you look over here, it says allograph, and then if you look over here, it says autograph. So be very, very careful, because sometimes the words are very, very close. So you've got to look at your prefix and your suffix, okay? Autograph. And then bursa. Bursa is a sac filled with liquid, right? It's a fluid liquid sac. So that's on your hand most times. So if you have bursitis, sometimes they have to do an injection. And if you look in musculoskeletal, sometimes that question comes with a bursitis, with maybe possible ultrasound or something. So you have to read it carefully. Carpal tunnel syndrome, that is, like a little bump on your wrist. So so that's a diagnosis. Bunion. Bunion is something on your big toe, or they call it great toe. All right. Let's look up some of those common. Dislocation occurs with an extreme force put on a ligament, causing the two bones to separate. So that is sometimes you might see with dislocation, and the doctor has to go in and do his job. All right. So that's another term that we will see right there. So let's look at some more terms. All right, let me pull it all the way down so you can see electromyogram. So they're evaluating. So gram is a procedure, a test to evaluate nerve and muscle function. Enthesopathy, there is a disease going on. So pathy. Look at femur. Femur is the thigh bone. So now you know that that's an anatomical site. That's a body part versus a procedure. And this is a diagnosis, and that's a body part. Okay? Fibromyalgia, that is a diagnosis. Fracture, that is a diagnosis. So be very careful when you're reading these things. This is musculoskeletal. You can break all these bones. It's a fracture or a dislocation. So that's a part of it. Gout. Look at humerus. That is a body part. So you can break or fracture your femur as well as your humerus. And the procedures are the same. So when you're going through your CPT manual, be careful. Look at the top what body part they're looking at, because the wording or the description of the procedure looks the same. The codes are different, but looks the same. So make sure you notate at the top to say, okay, what body part are we working on? So make sure you look at, identify what body part. That's why it's very important. Okay, my camera moving. All right, we're moving on up. Ligaments. All right. That's a body part. Meniscus. So let's stop right here. Meniscus, we're gonna discuss this for a little. So in your meniscus, that's in your knee. That a lot of the times that comes on the CPC exam, the knee arthroscopy. And when they're working on the meniscus, possibly from an injury, they do an arthroscopy. So they might do a knee arthroscopy, and they might be working on the meniscus. Either they're repairing, they're removing, they're shaving, they're debriding. Be careful of when you're reading it. It might say medial and lateral. Look at those keywords. Sometimes the codes might say medial and. The word and lateral versus medial or lateral. So you see I'm emphasizing those two codes, medial or lateral, or medial and lateral for the meniscus. So be careful when you're doing that knee arthroscopy of the meniscus, okay? They might do meniscus ectomy, meniscus repair, all that type of stuff. All right, so you have the myelogram, that's a procedure, and they're doing an injection of a dye. And then let's look up the top here. We have more stuff up here. And I pull it all the way down so you can see it. Here's another one that we have to stop at. The ORIF. A lot of the questions in musculoskeleton speaks on ORIF, where they make an excision, they open up the area, and then they basically do what they have to do. They put in rods, they put in wires, all of that. So when you're reading the scenario, focus on whether it's open, closed, or percutaneous. So ORIF, you might see it. And when you read a question, focus on, is it an open procedure? Is it closed? Is it percutaneous? What did they do? Then you can identify ORIF. Or they might give you that abbreviation ORIF. So be careful. Osteoarthritis, osteomyelitis, osteoporosis. You notice that all of them say osteo, but the end is different. All of them are diagnoses. Patella, that's a body part. Okay. Prosthesis. So look at prosthesis right here. See? Prosthesis. So if you're following me with me, you'll see prosthesis. Now with prosthesis, my instructor taught me this that made it easier for me to say, once you say prosthesis, is a foreign body. Okay, so foreign body is a tumor, a tumor, all that type of stuff, lesion, things that they put in your body. Those are foreign bodies. All of them are foreign bodies because you were not born with them. Okay, all right. The radius is another body part. Rheumatoid arthritis, that's a common diagnosis with a lot of patients. So let's go down. You have soft tissue. And let me see if there are others. Sprains, strains, 7-year-old fluid. You will see a lot of that. The tendonitis. Okay, let us stop at trigger finger. Trigger finger, be careful. You might see trigger finger versus trigger point. So pay attention to what you see. And they might give you the code for both the trigger finger and the trigger point. So be careful of what you're reading, okay? And this is it for today. And we'll see you one more time when we focus on another set of keywords. Again, I'm Coach Des from HealthEversity. Have a good one.